Hi, my name's Jude. I'm an occupational therapist and I am here today to talk to you about the best chairs for stroke patients. So if you're caring for a stroke survivor, you're not sure what to look for in supportive seating, then in this video we're going to consider how a stroke might affect a person's seating need and what key features in specialist seating might be best suited to different stages of stroke recovery. So first of all, we'll just look at what a stroke is and the impact that it might have on an individual. So a stroke occurs when the blood supply to the brain is interrupted. The effects can vary greatly depending on the area of the brain that's affected and the size of the injury. So the effects can be physical, for example, weakness or paralysis, tone issues, so high tone or lower tone, loss of sensation, fatigue. The effects can also be cognitive, so difficulties with communication, with memory, with concentration, spatial awareness and perceptual difficulties. They can be emotional, so for example, mood changes and personality shifts, and they can be sensory, so for example, partial or complete vision loss. The needs will change throughout recovery, and seating is an active tool to help regain function and independence. So seating should be adaptable to support this. So always consult with your clinician for professional guidance and support. Now let's consider some key seating features and how they can help support good posture and maximize function. First of all, the tilt in space. So this can be positioned upright for meals and activities, and in that way helps support swallowing and also engagement. The tilt in space can also be used dynamically for rest and for pressure relief at appropriate times during the day. When repositioning or assisting to reposition somebody, remember to check the affected side during adjustments, because loss of sensation can mean that the person may not feel if skin is being pinched or dragged. Also look at backrest wedges, the cocoon backrest and lateral support backrest. These can help to stabilize the trunk if the upper body weakness is resulting in leaning. If the pelvis and the spine are not in alignment, then the head can naturally tilt too. Head and neck support, like a horseshoe cushion, can help keep the head safely upright and aligned. Your choice of armrest to provide correct alignment and minimize risk of subluxation, which is partial dislocation of the humerus from the shoulder socket due to the muscle weakness or paralysis, and can be impacted significantly by gravity if there is insufficient support. A central leg rest to stop the legs from splaying out, and a foot pad to keep feet planted and bearing weight where possible if the lower body weakness or paralysis is impacting on posture. Braked casters and a push handle to support easier transportation of the chair and increase opportunities for social engagement. Adjustability is key, as needs will change as recovery progresses. A chair that can be reconfigured with different accessories over time is far more cost-effective and clinically appropriate than replacing the chair at each stage. So this is the Lento Care chair next to me, which has a range of accessories and is compatible with hoisting equipment. And on the other side of me here is the Lento Mobile, which also has a range of accessories and is very adaptable. It's important to remember that every stroke is different and needs can change week by week. A joint seating assessment with a healthcare professional and an equipment specialist is essential. Vivid Care offer a free, no obligation equipment assessment to help map clinical recommendations to the right seating and cushion solutions.